Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I'm talking today to Dr. Scott Conard, a family physician, one who loves working with other doctors. He's been the author of 5 books, including one that deals with the art of medical leadership. And he now works, and he's built a number of practices over the years that I'm going to let him tell you about. And he also now works with corporations to help them maximize the return on their investment in primary care. Dr. Conard, thanks so much for joining with us.
Thank you, Larry. It's exciting to be here.
And just to let the audience know that we had to schedule this interview around Dr. Conard's travel, so he's in an airport. So if you hear some background noise, it will be temporary. Dr. Conard, could you share with people, give them an idea of the kinds of work you've done building primary care practices over the years?
Yes. So 3 or 4 quick points. One is that, I'm from Florida. I went to South Florida to med school, went to Southwestern and Dallas to my residency program. And, I was chief resident. I was in the top, 20% of my medical school class. So when I came out, I thought I was just all that in a bag of chips. And I went into practice in Irving, Texas. And 7 years into my practice, I had 3 people in their 40s all die over the course of one summer. And in that moment, it became really clear to me as I looked at their charts that I'd been missing the boat. And I should be a risk management expert, not a symptom management expert. And I transformed my practice at that moment over the next, the rest of my career into a risk management platform that was really about what's your risk and how do we manage it effectively. And our reason for existing was to add years to your life and life to your years by empowering you, the patient, to take control of your health. And so the practice grew, became very successful. We had 3 offices, 13 docs. We were rocking and rolling when another company came in and said, Scott, what you've created here is really unique. We'd like you to do that for our 183 or 182 doctors' offices. And so at that moment, I became the Chief Medical and Strategy Officer for 343 doctors, 70% primary care. And we started transforming their practices from a symptom-based practice to a risk-based practice through the use of big data. And long story short, 4 years later, we were $16 or $17 per member per month, less expensive than the other practices in North Texas. Blue Cross Blue Shield called up and said, wow, you have 400,000 of our patients, and you're $17 a month less expensive. So I worked with their medical director, and we set up bonus programs and got everybody going on BTE patterns of excellence or whatever they call it. And we also started to be able to pay our docs more because of the quality, and it was exciting times. 4 years later, a large hospital system came knocking and said, hey, we want to buy you and form an ACO and do all this risk management. You've proven how well you do it, blah, blah, blah. They did, and within 90 days, they dismantled all of the population health activities. And when I went and saw the chief strategy officer and said, dude, what just happened? He said, you don't get it, but that $17 is coming from our hospitals. And that hurt our hospitals, and you're an irresponsible human being for doing that to us. And if that had been able to continue, we might have, we were hundreds of millions of dollars down on revenue that we would have generated if your doctors had not been, acting the way they were. And so at that moment, I got really, really clear that I had a different purpose in my life than working at that hospital system. And after I got through the anger, which took months, took a deep breath and started to work with corporations, and that's where I am today. I still practice medicine. I have 2 nurse practitioners that work with me. We run both a private practice and an on-site clinic for a big energy company. And so I'm very active clinically, but I advise corporations on how to buy care and how to give value-based care and how not to get snookered into a bunch of pretty words that don't really mean anything, which is what I see in the marketplace frequently.
Thank you for that background. That's very helpful. So you've been a family physician leader who has build community-based practices that deliver high-quality, patient-centered care. What's your view of the current impediments to family physicians taking back control of the primary care delivery system?
So, Larry, I think of it differently than taking back control. I think that implicit in the question is that we don't have control already. And the truth of the matter is, I believe the biggest thing that's keeping us from expressing and flexing our muscles is our lack of organization and our lack of availability. And here's what I mean by that. So as an example, I'm in Little Rock, Arkansas right now. I work with Stevens, which is a big health insurance brokerage firm, as well as Holmes Murphy in Dallas. And, you know, we have over 2,000 companies that I meet with. And when I sit down and, this morning, there were, 8 junior colleges that all got together, and they're like, we want to improve the quality and the value of care for our people. What can we do? And the answer is it's all built on a foundation of we have data, and then we have to make sure we match your people with great primary care. And if we do that, we're going to start catching things earlier, manage things better, decreasing the downstream needs for specialist hospitals, facilities, and as a result, your costs will come down. And they're like, perfect, let's do it. How do I do that? And the answer to the question is, well, family medicine is not organized. There's no easy way to do that. There are movements in the United States like direct primary care. There are insurance companies, which are claims adjudication and network management companies, but they really, to be frank, are not medically oriented. They're actuarial companies that have tried to do a good job but have not been able to get their arms around control or managing cost. And they're not really incented to manage costs, to be honest. So they've tried to do some things, but that's not worked. And so I am in this conversation hundreds of times a year saying, as soon as primary care gets organized, would you buy their services? And the answer is unequivocally, absolutely. And then I have to explain that while we have a lot of great concepts, we don't have standard ways to find great primary care doctors. And in fact, when you look at your healthcare claims, there are testosterone clinics, there are weight loss clinics, there are other specialty clinics, pain management, that are all being paid and attributed by the data to your primary care spend, and that's not primary care. Then you've got a bunch of urgent care and cough and cold clinics and blah, blah, blah. That is an aspect of primary care, but it's not comprehensive primary care. And so at the end of the day, we're looking for those unicorns that will actually take great care of people, get proactive, then that are focused on risk management. And so, Larry, I actually think that we don't have to, fight the specialists or fight the hospitals or fight the insurance companies or anybody else. What we need to do is get organized and put a product out there people can buy. And there's a huge marketplace if we do that.
Well, that sounds like we could have more control than we are exercising right now.
Well, I'll be frank. I think control is a myth. I really don't think you control much in life. I think you can have tremendous influence, though. And I think that it would be a correct statement to say we're squandering the tremendous influence that we have at this moment. And I'm not being critical. I'm not blaming anybody.
Right.
I look in the mirror every day and I see a leader who's been passionate about this for 32 years, who's been out there doing everything he knows to do, and it's not done yet. And so I have to really look in the mirror and say, if I were a better, more competent leader, we would be in the situation we're in. So please don't hear this as criticism of other people. It's just where we are. And so the question really becomes, what can we do about it? And I think that just as, when I meet with the self-funded companies, right now in the companies that I have the pleasure of consulting with, there's well over $15 billion worth of healthcare spent that is being spent. And guess what their most common response is when I say, why are you not being more proactive with what you're doing?
Okay.
But hang on, Larry, when you ask them the question, why aren't you doing more, what they say is, because we have no control. Because we're powerless. Right. We're pawns. And I'm going, you're writing $15 billion worth of checks. You have tremendous control. And they're like, but we don't know how to use it. We don't know what to do. And I see the same thing with primary care. we as a group have not gotten organized. We haven't put out a product, which is, the mission of primary care that's accessible to people in the community. And we don't feel powerful when in truth we are tremendously influential, and we could do so much more than we currently are.
Fair enough. So one of the things that I hear from primary care docs, family physicians, when they talk about their the burden that they're experiencing, is they talk about being on the RVU-driven hamster wheel. And in your opinion, what will it take to move from a production-oriented system driven by RVUs to a healing-oriented approach to primary care service delivery?
So there's no single answer, and healthcare is regional, and the question is, why are you on an RVU or are you on a fee-for-service? And, there's just a lot of nuance to your question. But in general, let me try to answer it to the best of my ability. And that is,
okay.
So let's go back to 2006. That's when I sold my practice and became the chief medical and strategy officer of that large, medical group. And we were very entrenched in a fee-for-service system. We had the majority of our doctors on paper. We had every reason to complain and whine that we didn't have the resources and tools to go do that. We were 70% primary care, so we were not a high-margin company. But I really believe that all of us need to just take the cards we're dealt and play the best hands we can. So what we did was we started looking at how to increase the preventive services that we delivered. And so we created checklists and we trained our MAs, and we started to do more proactive diabetes management, trained the MAs on that. And again, it's not like we're training them with something that any doctor couldn't sit down and spend a half hour going over, and bought some little templates from the American Diabetes Association and things. And then we started scheduling appointments for people to come in and learn about those things. And we even did a group appointment, and it didn't take a lot of doctor time. So what we started to do, what the formula we had was the average the average revenue per visit went from about $95 per visit. And again, this was 12 years ago, but $95 per visit up to $132 per visit, because we were doing a much more comprehensive exam, a lot more preventive care, and we did a lot more teaching, and we were giving immunizations and so forth and so on. And the average doctor saw an increase in their revenue by about 35%, and because that all fell straight to the bottom line. And the other thing that happened was we started asking doctors to bring in nurse practitioners who are very, very oriented toward teaching. Whereas a doctor is more transactionally oriented. We like to get in, figure out what's going on, and go on to the next patient. Nurse practitioners tend to be teachers. And with 80% of the visits that come to most primary care doctor's office being chronic care, we had them start seeing the nurse practitioner. We put the nurse practitioner in charge of the health literacy, or the level of understanding of those patients, and started, having them come in for teaching visits, which, it took a long time to get the patients to understand that it's more than just getting a pill. It's actually understanding what's going on in your body. And so to finish up this, response, the doctor, then we asked him to take another half day off. So kind of the formula that we had was, you came in, we got the doctors to become more population health wellness guides. We brought in more staff around them gradually over time. We trained their MAs to be more competent and to do more so that the doctor could do less. And then we brought in a professional nurse practitioner who could bill and collect in insurance companies. And by the end of the second year, it was not uncommon to have a family doctor that was making, $100,000 to $150,000 more than they were the day they started with our company. And that's part of why we went from 343 to 510 providers in 4 years. So I think, fee-for-service, if you get organized and proactive, actually you can do very, very well. But it's hard, and it's a lot of work, and in all fairness to the doctors who might be listening to this that are in solo practice or small practice, you don't have a lot of resources like that. So you really just have to take little teeny baby steps and ask, what are the 3 things I can do in the next week or month, and start stepping it out to become more proactive that puts you at greater value to the system. They're going to reward you in a fee-for-service, and of course in the other environment, a prepaid healthcare environment like a direct primary care. You will be. I would strongly recommend that you have clauses in there to get rewarded for that. And you have to. That's the cards are being dealt right now. Now, in an ideal world, would it be different? Yes, but that's where we're at right now. And as one who worked with a team of 3 other people to take a company from 300 million to 550 million. That's exactly what we did. Nothing different than I recommend doctors do that are in 1s or 2s practices today.
Great. Thank you for that. So you'll be a leader in the Healthcare Innovators Network event on Friday, November 9th, held in conjunction with the 2018 FMEC annual meeting. And you've been part of the leadership discussion group that's now met a few times. What do you hope will happen as a result of your participation in the Innovators Network meeting?
I hope that we put forth a vision for the future of primary care that touch, moves, and inspires the country, the doctors and their staffs, and the patients that are coming to them. And through, proactive, not negative, not angry, not, critical language, and through a shared vision of what's possible if primary care does a great job and has access and is compensated appropriately. And then we start, the people that are coming to this meeting are just incredible. I mean, just amazing people. I'm so honored I don't know what I'm doing in the room, to be frank, to be with these leaders in primary care in America today. And my role, or what I see myself doing, is to bring a dose of look, just take the next step, take the next step, take the next step. People grossly overestimate what they can achieve in a month and underestimate what they can achieve in a year. So let's not wait for tomorrow. Let's not wait for something to change in the system. Let's take and manage aggressively the possibilities that we can manage. And in that, I know that there is success to be found. In 4 years, we were incredibly successful, and if you just gone back to the beginning of that, they would have said there's no way you can accomplish what you accomplished. So I will be a force toward framing a very positive message, a message that will inspire the people who need our care. Hang on, I'm going to try to move to a place that's quieter, that need our care, for us to put up a model that corporations can purchase and bring people to our practice that rewards excellence in the principles of family medicine, and to start nurturing and taking care of the doctors that are out there that have a broken heart. I see so many doctors today that went into medicine to be secure, successful, and to be able to make a difference. And at this time, they're so beat down, upset, frustrated, and disappointed that that they don't even want to go to work every day. And to me, that is just a tragedy. And I'm committed to making sure that they get up in the morning and they're excited to go to work and be rewarded for the tremendous value they provide their patients in our communities.
Dr. Conard, thank you very much for sharing your perspective. I have to say personally that since I first met you at the Direct Primary Care Summit back in Indianapolis, and I've heard your perspective now 3 or 4 times at least, I just have to admire the positive approach that you have, and I think it reflects your success over the years. And I think you're a part of this team, this leadership group for the Innovators Network, because you're all affirming the value, the positive value and influence of family medicine and primary care, and you're all committed to articulating for employers and for America what family medicine can provide, particularly around the healing orientation and taking better care of patients and communities, as well as the caregivers. So thank you very much. And I want to mention to people who may be interested, Dr. Conard's book that I'm working my way through, I shouldn't say working my way through, reading my way through right now, is The Art of Medical Leadership. He's the author of, I think, a total of 5 books, and I'm looking forward to reading each one and Dr. Conard will be at not only the Innovators Network, but the Family Medicine Education Consortium annual meeting. So I encourage people to meet him and get to know him as I have. Dr. Conard, thank you very much.
Oh, it's my pleasure, Larry. And, for those doctors that are listening to this, there is no pot at the end of the rainbow. All there is what we can do today. And I'd really strongly encourage every one of us to just figure out what are the 2 or 3 little things that we could do to make our lives more enjoyable and make a bigger difference to the patients we serve, and be very optimistic that, everybody in your office looks to you as a leader and you make a difference. And so start to assume that influential position that you already have, start to appreciate how much many people care about you and what a huge difference you make in so many people's lives. And even though people don't acknowledge that for you every day, just know there are many of us who are inspired by you and get up every day to see what we can do to help your lives get better and better.
Thank you, Dr. Conard.
Thank you, Larry. I'll see you in a couple weeks.